Very, very warm good evening to you, Dr. Meenakshi Ahuja. Dr. Meenakshi is director at La Femme. She's also president of the Indian Menopausal Society, and she's the academic secretary for the Delhi Gynecology Forum. Dr. Meenakshi, a very, very warm welcome to you, and thank you for joining us on CII IWN's Need of the Hour. Warm welcome, Dr. Meenakshi.
Thank you for having me here.
Thank you so much for being with us. So today, as we have Dr. Meenakshi Ahuja with us, we are going to focus on COVID as it relates to women's health. So Dr. Meenakshi, there is so much out there. There are so many questions as they relate to vaccines, as they relate to pregnancy, as they relate to even women who are giving birth. And so let's just start off with, can a pregnant woman take a vaccine? Let's start there.
So definitely all of us recognize as gynecologists that the vaccine is really important. Even if it would not prevent you having the disease, it would make the disease course much milder, right? And pregnant women having their immunity low and being responsible for 2 lives at that time, the vaccine is actually quite important. Unfortunately, the Indian vaccines, that is the Covishield as well as the Covaxin, have still not been licensed by ICMR for pregnancy. So all of us as gynecologists have been applying for it, but as of today, as we stand today, the vaccine is not recommended in pregnant women by the ICMR.
Okay, wow. That is very important to know. So, okay. And what about a woman who is planning a family? Can she take the vaccine or should she also wait?
Absolutely. I think it's essential that every woman take the vaccine right away or as soon as possible, even if she's planning a pregnancy. It's not going to harm you at all. It's not that if you take the vaccine, you have to wait for an X amount of time before you can plan. So as long as you're not already pregnant, what I mean is that you've not already missed your period. So even if you've been trying in that month, say you got your period on the 10th and you got the vaccine on the 20th or the 30th, it's perfectly fine. As long as you've not missed your period, and when you get the vaccine, it should be fine. So you can get the vaccine and you should. And it's all right even if you conceive after, say, the first dose and don't get the second dose. At least some protection would be there. So women who are planning their pregnancies, I say, go ahead, get the vaccine done. If we are not pregnant by the time it's the time for the second dose, get the second one done. Otherwise, you're at least better off during your pregnancy as compared to having no dose at all.
Okay, and if you are, say, trying to conceive and then you take your first jab, and let's say, sorry, so if you are trying to conceive, you take your first jab, then should you wait to try and conceive and just finish your second jab? Or I'm just wondering, does it interfere? Yeah. Let's say you take your second jab and then you get immediately pregnant.
No, it's not going to interfere in you getting pregnant. It's not going to make any difference at all. The only benefit is that obviously any course, when completed fully, that's going to give you the best protection. So yeah, compared to the way the situation is today, and you feel that it's imperative that you get your first, you get your complete dose, then it's a good idea to get both the jabs and then get pregnant. But the vaccine should not prevent you from planning a pregnancy if you want to go ahead.
Okay, that's a very good point to know. If you are over 18 and on birth control, can you take the vaccine?
Absolutely. So see, even if you're sexually active, or as we know that now girls are having PCOD and hormonal issues, irregular cycles, a lot of them are on birth control. So there was a lot of hype happening about when you can and not take the vaccine. If you're taking any treatment as such, as in that you're on birth control for any reason, you can definitely go ahead and get the vaccination. There is no particular phase. You can get it while you're on the pill or off it. There's no problem.
Okay. And then I know this may perhaps be a little bit early, but does the vaccine affect fertility? Because there's so much, again, confusion about that.
Yeah. So there is no study that the vaccine affects fertility. So let's be very clear. We've been taking vaccines for years, This is a vaccine which has probably been made in a hurry. And since everyone talks about it, we are all, apprehensive. And these are the things which come in one's mind. I hope it's not going to affect your fertility. And a lot of patients, when the vaccine came and asked me, So my daughter, being a healthcare worker, was vaccinated with us in the first go itself. So I always give this example that no, I mean, it's like when babies are born also, they start getting their vaccinations. Every vaccine works the same way. It works on your immunity, not on your eggs or ovaries or anything. So it's not going
Okay.
to affect your fertility. Please go ahead and take your vaccine.
Okay, thank you so much. That's a very, very good clarification, and it helps us all in processing this. How does the vaccine affect menopause?
It really doesn't. So whether you're perimenopausal, it's not going to affect your hormones at all. Let me put it like that. It's not going to make your cycle irregular. It's possible. There are a lot of people who are calling me up and saying that, Doc, I think I've missed my period. Do you think that it's because I got my first dose of vaccination, or my period came in 15 days? Do you think it's because of the vaccination? No, it's definitely not because of the vaccination, but all of us are going and processing so much stress at this time.
Yeah.
It's a completely unprecedented situation. So there are people who, that stress, you may have people who are sick in the family, or there's so much of WhatsApp going on, or you're seeing the news with these cylinders not being available and people dying because of lack of oxygen. It's bound to affect your hormones, You remember when we were in school and there were exams and all, and we used to miss our periods, or, there's a sports tournament, they used to come in early. So it's exactly the same thing. It's the stress of the disease and the situation that we are all in, which is changing our cycles. It's not the vaccine, and not COVID also, actually. It's just the stress.
Wow, it's actually true, because the mind really does impact the body, right?
Absolutely.
So if you are suffering from cysts, endometriosis, fibroids, can you still take the vaccine?
Absolutely. So whether you are suffering from them or you're taking treatment for them, for cysts, you could be again on something like a birth control. You could be on medications like progesterones for your endometriosis. Fibroids also, you could be on medical management. In fact, it's possible. I've had patients who've had, say, their surgery is done, say, about 15 days back or 20 days back. Nothing at all impacts. Please go ahead and take your vaccine. Unless and until you are pregnant already or you're breastfeeding, you must take your vaccination.
Okay. I'm just going to ask you a couple of more questions while we're getting more and more questions in there. But since we've got 5 right now, I'm going to keep on asking some of mine. What happens in a woman? What happens if a woman is pregnant and gets COVID?
So unfortunately, like I said, women are not immune to any disease. If anything, when they're pregnant, their immunity is down and they are getting COVID. I have a lot of patients of mine who currently are going through COVID in different phases of their pregnancy. So, what the good thing is that the women who are pregnant are trying to keep themselves isolated at home. And they're very, very particular. Women are very particular. They're not even getting house help and all inside the house, just because they want to protect themselves during their pregnancy. But we always forget that, your partners are going out, your in-laws are going out. And if there are other people who are going out of the house, who you're not going to wear a mask with, it's actually the same thing as if you're going out. So if you're sleeping with your husband in the bedroom and he's going to office and not wearing a mask there, he is bound to get infection. Or when people say that, no, I didn't go to party, but my husband is going for the parties, he is going to get the infection back home. So yes, a lot of women have been affected because of COVID in pregnancy, and it actually, thankfully, takes a similar turn in pregnancy. It doesn't turn worse because you're pregnant, thankfully. But yes, the repercussions in the pregnant woman are probably more there because there are certain drugs we can't use. Also, then, people remain in denial and they don't isolate on first day or start the treatment or management early, because you have that in your mind that I don't think it's COVID, or maybe I'm pregnant, I can't take this medication. And the key of treatment in COVID is to, first thing is accept it the minute it happens and start the treatment as soon as it happens. So if you waste those precious 3-4 days thinking that I don't think I should be taking these medicines and, let me just avoid it and all, that's where the problems happen. I've had patients who've had problems in their pregnancy. So
can you share with us what are some of those complications or problems that have arisen?
The first, let's divide the pregnancy, say, into the 3 trimesters.
Okay.
So the first trimester is when the organs are forming actually. That is the first 3 months of pregnancy. So again, because of the stress or because of the high fever itself, people can miscarry. So the thinking that you're going to avoid taking that crocin is going to cause you more trouble. So take the dolo or the crocin or the paracetamol in time, because a high fever can itself cause abortions. I had a patient who connected with me. She was showing someone else, but her D dimers went haywire and she just aborted at 20 weeks, which is like a terrible time, 5 months of pregnancy, and she just miscarried and she lost the baby. But otherwise, by and large, in the second trimester, that's say from 12 to 26 to 28 weeks, the pregnancy is in a safe state. And if you start your treatment in time, I've not really seen much problems happen. The other problems happen when you must understand that if you're pregnant and you're in the third trimester and say COVID takes turn for the worse, we all know that in 90% it's going to be a mild illness. It's not going to affect anything. You're going to take your treatment. You're going to remain isolated. And say 2 weeks back, you're back to normal and your routine, which is what is going to happen to you most probably. But if you end up being in those 5% where your lungs are involved, the problem is more because there's a big baby which is pushing up your lungs. Your diaphragm is being pushed up. So you can't breathe comfortably. And probably that time, if you need hospitalization, there are two problems. Say if I'm working in a setup, which is a non-COVID facility, say La Femme is a COVID negative facility. It gives patients the confidence that there are no COVID patients. See, we are all very selfish. We first have to start working on ourselves. So you want to deliver where there is no COVID. You don't want to get the infection from someone else at the hospital when you've been so careful. So say the patient is delivering there, but if she becomes COVID positive, then even she's booked at my hospital, she can't deliver with us. She will go to a sister facility like Fortis Shalimar Bagh or Fortis Vasant Kunj and deliver there. I, as her doctor or caregiver, I'm also working in a COVID negative facility to keep my other patients safe. I cannot go and deliver in a COVID positive facility.
Yeah, absolutely.
So the first thing which happens is that, suddenly, and that if you're in a COVID ward, no one else is with you there, right? So suddenly you're unwell and you're pregnant, and say if you need medical help, you are suddenly at a young age, probably the first time pregnancy and deliveries are so many people. It's the first time you actually go and get admitted in a hospital because you're a young girl. You've never needed hospitalization before. And suddenly you are thrown into a place without your family support, into a place which is completely alien and new to you. And there are doctors who are new to you and they're all in those blue PP kits and all. For a 26 or a 30-year-old, it can be really traumatic. So that's why I always tell the patients that the best way to deal with this is prevent it. And not only be strict with yourself, but with the rest of the family. So when you get admitted and you're having respiratory distress, the first thing is going to be done is that the baby is going to be pulled out.
Yes.
Because your lungs can't breathe otherwise. So if the baby is going to be pulled out, that means that your baby is a preemie. It's going to be a preterm delivery because as far as the medical help is concerned, the woman comes before the child. So there we have another problem, that prematurity is a risk that we are with if a mother is COVID positive and takes a turn for the worse when she needs to go to the hospital for oxygenation, which is not happening. That time the baby will be needed to be pulled out. So don't get into that state. That's the important thing to understand, that otherwise COVID is not going to be worse. But if you are near your term and you have a respiratory distress, for your safety, the baby needs to come out.
Wow. Thank you for that. That was wonderful. And I'm glad you explained everything. And so I just have a question. I mean, I'm just thinking about the mental, emotional state of this person, because the doctor you've known, the family support, nobody can really enter at this time. It's just such a different way of...
Absolutely. So this girl, which I was telling you, the one who was 20 weeks, like I said, she wasn't my patient. She was someone else's. And I was down with COVID myself at that time. But she rang me up at 4 o'clock saying that, Doc, my friend comes to you and all, and this is what has happened, and I'm having cramps, and I've been just told to go to a new place. And, I actually, just at the end of the day, we are all humans. And over the phone, I just handheld her that time at 6 in the morning. Then she rang me again that, I've aborted and I've lost the pregnancy, doc. But I don't know what they're doing here. What do you think they're going to do? So every half an hour, she needed to talk to me over the phone. So, and she wasn't even my patient. But the point is that because she was looking for that support, I had to be there for her. So I could actually understand that how scary it can be, because, you put yourself or your children in that place and you feel that it's not just the disease, it's the whole package. That's, till the time you're home and all, it's all fine. And that's why when you start with COVID, start your treatment in time.
Yeah,
absolutely. And believe that you're going to be in the 90%. Believe in it. Just monitor yourself well, eat well, breathe well. You will probably get out of it without any risk if you don't stress yourself. But if things start going wrong, that's, it's really scary. We think the elderly ja rahe ho hospital, but for a young girl, it's probably even scarier.
Yeah, absolutely. No, I think you're absolutely right, even for women. But I think generally what you said is so important, Doc. We need to not deceive ourselves. We really need to say, I may have COVID. I need to isolate and I need to start my treatment. No need to panic. But in order for me to get through this, I need to start soon. So, Doc, now I'm going to switch over to the questions from the audience, if that's okay with you. Okay.
Perfect.
One from Glossy, is it okay if one is breastfeeding to have the vaccine?
So again, the same thing. Currently, the Indian vaccines, that is, are not recommended in breastfeeding. So a lot of patients have been asking me this. I hope by next week it would be, like the FOGSI, that is the Federation of Obs and Gynae, we are kind of pitching that it should be allowed in lactation. It's not harming anyone. But till the time studies are done, unfortunately, these things don't come out. Being life-saving, it is still not available. But patients who say probably now 8 months down lactating or 9 months down lactating, they ask me what I should do. I just tell them, I think it's more important to get the vaccination, the situation that we are in today. So probably just get your date for vaccination, and the day you get your date, after that, just wean off and stop breastfeeding, because at that stage, probably you will be able to look after yourself and your baby better if you're vaccinated than with that little milk which is going to the baby. Of course, if the baby is less than 6 months old, I would never recommend that you stop breastfeeding. But as of today, you cannot breastfeed and get the vaccine. It's not considered safe. It's not licensed, let me put it like that.
Okay. So, and if somebody even wants to, are you suggesting that they wait 6 months before they do it, till the baby is 6 months, and then you go ahead and
because then the baby is weaned off, is on other food also. Right. So that is a good time.
Okay. From Rinky, do we have to plan the vaccine on any days during the menstrual cycle?
The vaccine, again, I think there was a WhatsApp forward which is going on that when can you, girls don't take the vaccine if you're getting your periods, your immunity is down, blah, blah, blah. Not at all. You can take the vaccine before, during, after your periods. It has no relevance whatsoever.
Right. We've got another one. How does COVID affect women who have earlier suffered from breast cancer?
See, like I said, COVID is a viral illness. It's just that it affects multiple organs in the body. It is like any other, it is like a flu which goes bad, right? So whether you've had breast cancer earlier or you've had any other morbidity earlier, the only difference is that you come in the high comorbidity group. Whether you're a diabetic or you're a hypertensive, you're over 50, you come in the higher risk age group, which was a group which was offered the vaccine also earlier, like healthcare workers. So it's just that it's not going to change the course of the disease at all.
Okay. If one has taken the Gardasil vaccine a week back, can they still take this shot?
Absolutely. Gardasil is a killed vaccine, and so is this. It's not a live vaccine as such. Their immunity has no other effect on each other. In fact, even if you're taking the flu vaccine, that's a very good question, I think. So even if you're taking the flu vaccine, you can take it together, because everyone does take their flu shots once a year. So the flu shot or the Gardasil, it can be taken alongside. There's no problem.
Okay. Would you just like to tell our viewers what is the Gardasil for?
Yeah. So Gardasil is a very important vaccine for cervical cancer prevention. Cervical cancer is #2 cancer in women. By cervical, I don't mean the neck cervical. I mean the neck of the uterus. So that is #2 cancer in women after breast cancer. And it is probably the only cancer which is preventable by a vaccine. There are 3 doses, 0, 2, and 6 months. The Gardasil is the quadrivalent dosage, and there's something called Cervarix, which is a double valency dosage, but I prefer the Gardasil because it covers 4 strains. So the Gardasil is given to all women between 18 and 45, unless they are pregnant again. We don't give the vaccine while you're pregnant.
Okay, thank you very much for that, Doc, because that's a, a very good, clarification for people also to know what is it for. What is a better jab, Covishield or the Covaxin?
So all studies, I know, again, I'll be honest with you, it's a very interesting question because we healthcare workers, all started getting the vaccine first. So yes. At that time, the Covaxin was available only at 2 places, at LNJP and at Ram Manohar Lohia Hospital and AIIMS and their supply chain. The rest of the places everywhere, there was Covishield. And all of us had seen so much of COVID with people, and we knew how paranoid we were working for the whole year, that we just went and got the jab, which was most easily available and accessible. Okay. But once it was open to the public, this question came up. I don't think any doctor asked, what vaccine I should get. We just got the one which is available. So in all fairness, I must say that although there are some studies which are trying to say that Covaxin is better, or that Covishield has that risk of blood clots, which actually we don't see much in the Asian population, thankfully. They are both quite the same. Probably studies were done for longer with Covishield because, it's an international vaccine. Covaxin, the vaccine is relatively newer and it is being used only in India as such. So that is, the data is less comparatively. Yeah. So it doesn't mean that because the data is less, it's a safer vaccine. It's the same. So if you weigh both of the vaccines together, they're quite the same. So whatever is most easily accessible to you, there is no problem at all. There was some talk about if you're less than 30, maybe because AstraZeneca has more blood clots, maybe a good idea to get the Covaxin done, but not really. As of now, both the vaccines, whatever is more easily accessible to you and sooner, please go get it done.
Okay.
Also remember that both the doses should be the same vaccine. Don't be over smart and get one Covaxin and one Covishield thinking you get the benefit of both. You will take only the same vaccine.
Yes, that is very important. Okay, can pregnant women prone? That's from Divya.
Sorry?
Can pregnant women prone?
Can pregnant women?
Prone, I guess do that prone breathing.
Yeah, prone position. Yes, of course. Prone. So proning is good when the oxygen supply is getting less. So the only thing is that you use a couple of extra pillows or prone on half on a chair because you have to give space for the belly. That is the only thing. So if you're using extra pillows and you can, like those massage tables for pregnant women which have that big cut on the belly. So quite the same way that if you can just put pillows so that the tummy is not pressing, there's no point. And that would also be probably at full term. At 5-6 months and all, it's not going to make a difference. So just use extra pillows, but proning will always increase more oxygen to the lungs.
Okay, excellent. From Nandini, can babies born to COVID positive mothers have lung damage?
No, there is no such study that the babies are having lung damage. At the same time, when a woman who is, say, breastfeeding or just delivered and has COVID, we shift the babies to the mother immediately. So all mothers who are having COVID, unless, of course, their medical condition does not allow them to nurse the baby, the babies are with them, they are breastfeeding the babies. And because we assume that even if they were COVID, the babies are COVID positive already, because you all know that you can pass the infection even 5 days before you actually show the symptoms. Right? So then if the babies, you've been breastfeeding the baby all along or after delivery also, we let the baby be with the mother. It's considered much safer and better for the baby. The benefits far outweigh the risks.
Yeah. That's very true, especially when we talk about human contact with the mother and the baby.
Absolutely, absolutely. I think that also keeps a mother going, you know. At the
Yes.
same time, like I said, it's a strange environment. And probably having the baby with you at that time is only going to calm you down and also keep you busy into that, you know, format that you're doing something with your baby. And that's nurturing thing which comes in, and you feel that you want to get faster, get better faster for your baby. I think
Yeah.
that also helps.
I think so. I think you're very right. That sense of purpose. Now you've got somebody depending on you. You want to, we've got from Zia, what is the impact on the newborn if a mother has COVID? Is there
So, yeah. So, like I said, because the number one, the impact is obviously prematurity.
Yeah.
So, if the mother had a premature birth, that is one risk which is there. But otherwise, the baby will be kept with the mother, assuming that the baby may also turn COVID positive. As of now, in the first wave, children were not being affected at all, except probably the mothers who were pregnant and delivering. Now we are seeing more of younger COVID. And it's said that maybe the third wave, it's going to affect the children more because under 18 would not be vaccinated, and if schools open and all, that's probably the way the disease will reach the children more. But like we all know that it is all unsure, uncertain. So I guess we just keep our circle of health around us with everyone else vaccinated if and when it's available to us.
Right. Okay. How does COVID affect diabetic women? How can we ensure that COVID does not become severe for them?
Okay, so the risk with diabetes is that it can become more severe. That is one thing, because you are more prone to infections. And here again, more importantly, if someone is diabetic, please, please, please remember that prevention is the only, the best way to manage this problem. Once it happens, to say that, how can I see it doesn't, obviously starting your treatment in time, right? That is obviously going to help take care of the disease. But, like there've been so many, I've been listening to the talks, and there've been so much discussion medically that maybe 6-7 days you are starting steroids and all. That's going to make the sugar go haywire, right?
Yeah.
So because steroids will always increase the blood sugar. So yeah, you come in that group. And that is why probably from a long time, people who are diabetic, hypertensive, who are over 60, who are having other medical problems, we've been trying to kind of push that they remain safe, don't move out of the house at all, and don't get infection with the rest of the family. So yes, if there is some reason why your husband needs to go to work and he's younger or something like that, at least the parents should then be isolated. They should not be eating with you. As healthcare workers, we've been going out to work, and actually, my in-laws were eating separately all that while, because you don't want to take that chance that you pass out infection to anyone who is over 60 or with diabetes or hypertension.
Yeah, so anybody compromised or aged, you definitely don't want to risk it.
Absolutely, absolutely. Because it will always take, it should, I wouldn't say always, but yes, it should take, if you're healthier, it will, your body will have the ability to fight with the disease better. And with diabetes, we have that added problem of the sugars going haywire when the medication is given. So yeah. You have to be careful.
Okay, from Zia, how does COVID affect those on HRT?
It doesn't. So surprisingly, there are studies, in fact, like we said, steroids. Steroids is a horrible term, and people have been talking कि कभी भी हम birth control देते हैं या hormones तो नहीं, ये steroids तो नहीं. So actually, it's been seen that somehow estrogens, progesterones have studies that they're protective and they don't harm the COVID situation. So yes, people on HRT, they're not going to get affected. The only thing is that probably if you're on birth control, say you're eating birth control and you get COVID. So as of now, again, like I said, it's a very fluid situation. Probably if we do an update a month later, there might be some changes. So as of now, we tell you to stop your birth control immediately, because it is going to affect your coagulation. And because we know COVID can affect your coagulation, we don't want that. So your physician is treating you, and then there is that confusion about your D-dimers and all. So whatever unnecessary medications you're taking, what are not life-saving or otherwise, we won't say that आप अपनी BP की दवाई छोड़ दो या अपने hyperdiabetes की दवाई छोड़ो. But anything you're taking otherwise, just stop it so that it doesn't interact with your other treatment, which is going on.
Almost elective in a way.
Absolutely.
In a way, right?
Absolutely. Yeah.
Okay. From Ankita, after how long of taking the second vaccine dose should one wait if they are planning to conceive?
So see, like I said, you can conceive immediately after the second dose if you even wanted to get completely vaccinated before you wanted to plan a pregnancy. So the same month or the next month works. Your immunity, otherwise, whenever you take the vaccines, they say becomes the best in 6 weeks of the second dose. So, but you need it for the whole pregnancy, right? So even if you conceive earlier and it's going to kind of peak, say 6 weeks later or 8 weeks later, it's perfectly fine. So yes, while you are getting a second shot, please start trying if you are keen to get pregnant, seeing the situation, obviously, and seeing how mentally it's going to affect you. So if it is your happy place to get pregnant and you know that you are going to take care and your circle around you is protected, please go ahead and plan your pregnancy.
Thanks, Doc. From Aditi, what can a pregnant woman do to avoid COVID apart from following COVID protocols? How much zinc, vitamin C, and D is safe for a pregnant woman?
So vitamin C, let me start on that. So the first thing any pregnant woman can do exactly what everyone else does. That is masking, double masking now. And in this situation today, where you may have someone who's moving out of the house, that's another addition that I would advise for the next 1 month. Masking at home. It's very important. Okay, that's a new addition. Masking at home, double masking, and not eating your meals together. So these are very small steps, but at least from one person, it's not going, because now it has been seen, we've all seen, it is families who are affected.
Yes.
And your caregivers and your support system also gets affected. They can't help you out. So that basic thing that, you know, and with small children, say, both the parents getting affected, it becomes such a mess. So be very particular on these things, at least for the next 2 months. Then, like you said, vitamin C, I said, is a water-soluble vitamin. You can't have a toxicity of vitamin C. So take all the vitamin C you want. You can take 2 tablets in a day. You can eat limsi, you can eat kiwi, you can eat avla, whatever you want, there's no problem. Zinc, on the other hand, is fine. Zinc is something which also helps the body repair faster. So if you're taking 1 tablet of zinc every day, even in the first trimester, it's quite okay. It's not seen to cause any harm. Then what was the third thing she wanted to take?
Vitamin D. Vitamin D.
Vitamin D is considered safe in the first trimester. However, I, as a rule, don't give it in the first trimester because I like to avoid everything in the first trimester if possible. So after that, in pregnancy, the standard doses that we are giving everyone, say once a week, 60K, till you do take about 12 and then take once a month. Please go ahead and take it. But remember always that vitamin D is a fat-soluble vitamin. A, D, E, K. These are the 4 vitamins which can cause toxicity because they're fat-soluble. They stay in your body. So don't overdose yourself, pregnancy or no pregnancy.
What are the 4 again? Could you repeat them? Vitamin A,
D, E, K. So basically B and C are water soluble.
Okay.
So those you have as much as you want. It's not. So, you know, like if you would have noticed on a parallel note that when you get your blood test done, say, and you're getting your vitamins done, and suddenly you patients will call me up, my vitamin B is 1200. You know, like, why is it so high, doc? It shouldn't be more than 995 or something like that. And is it a toxicity? Am I going to have a problem? No, it's just in the blood. So it's going to get filtered out from your kidneys. It's not going to stay in your body. But vitamin D, if it is high, it is going to cause toxicity. So B and C are safe. Don't overdose the other ones.
Okay, thank you so much for that. That's wonderful to know. Now, I just want to take a second. We're 5 minutes over time. Can you stay and answer another 15-20 minutes? Would that be?
Of course.
Yeah? Okay, wonderful. So is the mortality rate different between men and women? Why?
So, you know, probably earlier we were saying that women are faring better in COVID. I think I can't say whether it is because of COVID or it is because women take better care of their health, or less women are moving out of the house, or women because they are caregivers at the house and they're taking care of their children. So they're very, very particular. You know, you must have noticed, at least in the socio-economic status that we all are, the women are more particular about, you know, taking care of this. Look at the audience we have today. Everyone's concerned. I don't think men are having meetings like this, where they're discussing the disease and seeing how to keep themselves and their families safe. So women do better on that. Also, diabetes and hypertension and other comorbidities happen faster in men. So there are women who drink, but they're not, you know, like they're not alcoholics as many as men, right? So somehow the comorbidities and the illnesses are more in men anyway. So they will always do worse. Women, because they've been, probably either sheltered or taking more care of about their family. And thankfully, like I said, the estrogen progesterone may be protecting us. Women do actually fare better than men in COVID.
Okay, thank you for that. From Jasleen, is it true that we should have a high protein diet if we get COVID? And the second part of her question is, does COVID get more severe after day 7 to day 10? How can we avoid hospitalization?
I think it's a very, very pertinent question. So COVID does get worse from day. So the first 5 days are when there's just we've done this day in and day out that there's going to be fever and all. But the cytokine storm, or the effect when is going to affect your lungs and other tissues, is going to happen between day 7 and day 10 or day 12. After that, when the recovery phase is going to start. So you can be very careful in this time by doing your testing and checking your oxygen throughout, doing your lung exercises, using a spirometer at home, and probably your blood test telling you that your oxygen is, or if your SpO2 is going down, or your D dimers are going up, or your CRP or your other inflammatory markers are going up, immediately starting your treatment under supervision of your doctor, be it steroids, be it blood thinners. So if that is all started in time, the disease will definitely not progress to worse. Okay. So it's just a timely management which is important. But at the same time, I would warn, and I always suggest that, whenever we are calling up friends and people asking about, their health when they're having COVID, don't confuse the issue by talking to them about D dimers or what is your CRP. Let the physician decide it. In fact, even as a gynecologist, if my patient is pregnant and say she's consulting me, it's a different thing. But say if she's under consultation with a physician, I'd say whatever he says, please go ahead and do it. Don't get into that. Probably what you should be asking is, how can I help? Yeah. If you call up anyone for their problem in COVID, please don't discuss their medical reports. I think the only thing you need to do is say, how can I help? Can I send a meal over? Can I just order some brownies and send them over for you and the kids or whatever? But probably that is a more important gesture, because there's so much confusion. Remdesivir deni hai, nahi deni, ye dena hai, wo dena hai. Don't get into that. You are not the person to decide. Or why has your doctor not given you this? Why has your doctor given you this steroid or not? So every patient is different. And there is a set protocol, but there is a variation according to every patient. So if that person is discussing with their doctor, just let it be. Probably giving them handy tips on, okay, your doctor says you need this. This is where it's available. Or should I arrange for this and send it to you? That is a better way of helping. Rather than saying, tumhe Medrol kyun diye or Decadron kyun nahi diye? How is that helping? It's not.
Right. Okay. From Sushmita, what precautions should mothers take when they are confirmed or suspected COVID-19? What precautions should mothers with confirmed or suspected COVID-19 take when breastfeeding?
So the precautions are exactly the same, because you are going to be isolated immediately and you get isolated with your baby, usually because you are breastfeeding. So continue breastfeeding. You can wear a mask when you're breastfeeding if you want, but otherwise I assume that since you're sleeping with the baby and otherwise you've already given the infection. On that note that you're having a glass of water, that is probably the most important tip I would give. Keep yourself well hydrated. So that definitely is a very important tip when you're breastfeeding, because you lose a lot of water with fever and you're losing it when you're lactating. So keep your water and hydration. Have nariyal pani maybe twice or thrice a day. Nibu pani, lassi, thach, pani. So that is very, very important. The other question which she had asked was, that is protein important? Yes, it is extremely important, because protein, there is tissue breakdown. What is the disease? What is CRP? It is that your tissue is breaking down. Tissue will regenerate with protein. So eat very well. So even if you've been on a diet before that, please eat all your 3 good, healthy meals. And again, bimaro wala khana nahi khana. If you're not ill, so you don't need to eat khichdi and dalia and all. Please have a good meal, whatever you feel like. Also, say if people at home are ill and you are out, then probably cook something nice. I mean, there's no reason why they need to eat moong duli dal and ghee ki sabzi. They can very well have pasta also. There's no problem.
I think you're making a lot of people very happy right now. Okay, from
no, but it's very important because, you know, if you're feeling good, you will be able to, you know, deal with your situation much better.
So you're saying it's fine to have one meal of comfort food.
Absolutely, absolutely. And keep your proteins up for sure.
Okay. From Malvika, how can one best protect themselves from COVID when they go to the hospital or doctor's office for unavoidable situations during pregnancy or otherwise?
Yeah. So again, good question. I would like to just clarify. I don't think any patient has actually got COVID from the hospital, especially if you're going to a doctor's clinic, like say Dr. Glossie's clinic for an ultrasound, or you're coming to a place like Le Femme where you are just coming because you are on your full alert. I see girls who wear double masks, which is very good, which is what everyone we expect. In fact, from the gate also, we don't let you in if you're not wearing a double mask or you're not wearing a good mask. But you're wearing the mask. People are wearing gloves. People are wearing dupattas all over them. They're wearing glasses. They're wearing gloves. And, you know, you're using sanitizer every minute. You are on a screen on the other side when you're seeing a doctor. So your doctor's also taking care. They're also using sanitizers. So you're not going to get it from the hospital. Please be very clear. You get the disease when you take your mask off. It's going to happen only when you're going to sit for a coffee with someone or go have a meal with someone. Because that's when your mask is off. If your mask is on and your hands are not touching your eyes or your mouth, you are not going to get COVID from anywhere in the hospital. Be clear on that. So don't be paranoid. Of course, keep your visits minimum because for us also it gets very taxing, you know, speaking with that mask and the screen. So we are doing a lot of video consults and getting over with that. But at the same time, I would really tell you that because everyone takes care when, you know, you feel that hospitals are nahi ho jaye. So everyone takes care when they go to the hospital. You would have realized that. You know, you will wear your mask and come back home and have a shower and everything. But when you go to your friend's house and have a cup of coffee, you never do that when you come back, right?
Very true. Okay, from Divya, we've got, if one has been on remdesivir, steroids, insulin due to the steroids, blood thinners, what should one watch out for while one is recovering?
So the steroid, the blood thinners are going on. You basically have to see that your oxygen doesn't go down, and you have to keep on getting your parameters checked every 48 to 72 hours. If they are haywire, probably 48 hours. If they are in normal range, maybe every 3 days. But they have to be checked till they come back to normal. And again, the same thing that as they go immediately, any of these things go out of range, just rectify it immediately. That's what you need to do.
Okay. If someone gets fever after 18 days of COVID, what does that mean? Have they been reinfected with COVID? This is from Rinki. Have we lost Dr. Meenakshi?
Yeah, she's just got dropped off. Dr. Meenakshi's got dropped off. I think she'll join us back in just 1 minute. So if we can just...
Yeah, we can hold on.
Yes.
She's shared some very, very interesting things today, you know, and I'm glad she explained the impact, especially on things like the vitamins.
Which are more related to women. No, absolutely.
Yeah.
And she's joined us back as well, Bhavna.
Wonderful, wonderful. So, Dr. Meenakshi.
I'm just asking her to unmute herself and...
Yeah, I'm just, yes. Someone will have to start my video.
Yes, we are doing that.
Yeah, thank you. So,
hi, Dr. Meenakshi.
Sorry. Yeah.
I'll just repeat the question. It's from Rinki.
Yes.
If someone gets fever after 18 days of COVID, what does that mean? Have they been reinfected with COVID?
So, frankly, you know, the COVID disease is usually over in 15 days. So, yes, that chance of reinfection should not be there because if your immunity is taken care of it, it should be okay. But we always say that continue being isolated till at least in your room, not the house. In the room till at least 10 days are done or 3 days of having no fever. If you have fever after 18 days, do check. It could be just a UTI or other things also that you must rule out at that time, because that can also happen. You've been dehydrated and you've got a UTI now, or you've got something else now. Not, or secondary bacterial infection. Because if you had a lung infection, a lung of involvement with the...
Okay, she's got dropped off again, Bhavna.
Yeah,
So
I think she's got dropped off again. Should we wait or should we now? Okay.
No, she's joined. She's back.
Okay, she's joined. Okay, wonderful. I think we'll just take another 1 or 2 questions and then...
Yeah. So,
yeah, you please unmute yourself, Dr. Meenakshi. Yeah, thank you. Okay, please unmute yourself.
yeah. So where were we at this point of time? Sorry.
No. So you basically said it could be anything to do with a UTI.
Yeah, so a UTI or a chest infection, a secondary bacterial infection. So it's possible that your doctor puts you on other antibiotics, which are not used in COVID, but otherwise, like a cefuroxime or an augmentin for a chest thing. It could be the cough. So probably a secondary bacterial infection, whether in the chest or a urinary tract, is definitely a possibility.
Great. From Zia, we've got, how does COVID affect women with thyroid disease?
It doesn't. It's just the same way. It doesn't affect you.
Okay.
Please just remember that if by chance you get COVID and you are on thyroid medication, please continue taking your medication every day so that your body's metabolism remains normal.
Okay. And this is our last question, Dr. Meenakshi, for the evening. Thank you so much. This is from Aditi. Is HCQ safe for pregnant women? Has it proven to be useful as a preventative measure?
We are not using it as a routine, as a preventive measure as of now. Okay. Let me just make a clear statement on that.
Okay, wonderful. Dr. Meenakshi, it has been an absolute pleasure and privilege to have you. And this is the second time. I know we hosted you for a webinar last year as well. And you are so articulate, and it's been absolutely wonderful having you with us today. Thank you so much for the wonderful spread of information. You've shared it beautifully.
Thank you so much. And sorry for the technical glitches which happened. I kept on getting calls on my phone. So I'm really sorry for that.
No, it's been our privilege and pleasure to have you with us. So thank you once again, Dr. Meenakshi Ahuja. And we look forward to seeing everybody back with us tomorrow, Monday to Friday, 5:30 to 6. Tomorrow, we've got Dr. Anupam Sibbal, who is a pediatrician and Director Apollo. He is going to be talking on COVID and your children's health. So do join us tomorrow, and we will look forward to seeing our audience and everyone tomorrow. Thank you so much.
Thank you. Thank you so much.